Well, thank you, Mr. Chairman, and thank you for holding this hearing on MTM, and appreciate all the witnesses being here and providing your insights. I think we recognize that there's a lot to be gained if we could focus more on getting the program to function at a more efficiently, but also the impact that it has on medication adherence, which is a goal that we can all share. Certainly, community pharmacists have been at the forefront of providing services such as medication therapy management. Pharmacists provided services such as MTM are important tools in our effort to improve medication adherence, patient health, as well as to improve healthcare affordability. I wanted to applaud Rite Aid for their active management and leadership on this issue, engagement with nearly 12,000 pharmacists across the country that are on the forefront every day, interfacing and treating patients. And Mr. McCullough, I wanted to start by just asking if you would review, I know you highlighted some, but as you think about the current program, the Medicare Part D MTM program, just review some of the benefits, the challenges that you're seeing day in and day out at Rite Aid.
Well, the biggest challenge that, well, let me start with the benefit. We have the opportunity with nearly 12,000 pharmacists trained to provide MTM services to be able to contract with a number of different plans to provide these services, and we do that anywhere we can. It's been tremendous. That being said, the identification of patients who are eligible is probably one of the bigger challenges that we have. Being able to expand that eligibility would be vital to help on a number of ways. As it is right now, the patients that come to us, they are oftentimes very, very complicated. They have a number of issues going on, and what we try to do is we try to engage them to help make sure that any disease state that they have is being appropriately treated, and any treatment that they have has a corresponding disease state for which it matches up. And through that process, they identify, a number of drug-related problems and work towards the resolution and the documentation to be able to communicate with other providers to make sure that we're all on the same page. Some of the biggest things that we have is just being able to get people in the door for these services. So while people may be eligible, getting them to accept that service is sometimes challenging. You have a number of patients that are somewhat skeptical. They're maybe a little naive of what the benefit of that program is. And I would suggest those are a couple of the bigger things that we see. Is we say, well, my doctor takes care of that. There's some perception that the healthcare, there's a healthcare system that exists that's different in their mind than what actually exists out there.
So address what you think a successful MTM program would look like, and then also highlight the populations that you think will benefit most.
I think what would be most successful is where we can intervene the earliest. The old expression goes, an ounce of prevention is worth a pound of cure. So the earlier we can intervene in any chronic disease state, and diabetes, COPD, cardiovascular disease are ones that come to mind very, very, very quickly. But anything that we can do earlier in the process will prevent disease progression. And ultimately what that'll do is that will eliminate healthcare costs downstream. So if we can intervene with a diabetic to prevent morbidities such as blindness, amputation, so on and so forth, those are benefits that are direct costs related to the healthcare system, but then there's also quality of life things that come in as well. Also, earlier intervention can prevent kidney disease progression like that. Diabetes is probably one of the low-hanging fruits, cardiovascular disease. But essentially, I'm probably of the mindset that any chronic disease state is fair game to start early on to prevent that progression.
Great. Okay. Thank you, and thank you, Chairman, for yielding me this time.
You're welcome.